So my name's Julian. I'm Head of Digital Development and Evaluation at Anna Freud, the National Centre for Children and Families, and I'm also a lecturer in evidence-based child and adolescent mental health at UCL. So today I'm going to talk through our experiences of developing an app to promote shared decision-making in young people with mental health difficulties. So I'm going to start by giving an overview of Power Up and the project. I'll then move on to thinking about why we might need to consider how we implement and adopt digital technology in healthcare settings. And then I'll close by sharing and reflecting on some of our experiences. So hopefully some of our experiences will chime with your own experiences, and it'll be really great to hear feedback from you guys as well. I want to start by saying a thank you to NIHR, who funded the programme, and also to a whole range of co-authors and collaborators on the project. And Professor Miranda Walpert is the principal investigator. I'd like to thank all of the young people, clinicians and carers who gave their views in the project in a variety of different ways. So we had these groups taking part in the study, but also we did a number of co-design and patient and public involvement sessions. So I want to say a thank you to everyone who's contributed their views. Across these organisations, we have UCL, the Anna Freud Centre, Create Marketing, who've been our digital partner and who've been developing the app, and they've been a really great partner to work with, so I want to say special thanks to them. We were working with MindTech on the project, and also Common Room Consulting, which is led by Kate Martin. So this is an organisation of young people with lived experience, and in addition to Kate, we have two young people with lived experience who are members of our steering group and deeply involved in the project. So I'll run through a bit of information about Power Up. If you do want further details, a protocol was recently published in the Journal for Medical Internet Research Protocols, so do Google it and you should be able to find it online. So really, as we've been hearing about from Chris and Louise, the aim of the project was really to try and put young people at the heart of their mental health care. And we know from research and our own work and our own consultations that young people often find it quite difficult to get their voices heard when accessing mental health services. And they can feel doubly marginalised at times through being both a young person and someone who's experiencing mental health difficulties. So we set out to develop an app and feasibility test it with the aim to promote and improve shared decision-making and collaborative practice with young people accessing mental health services. So we were initially aiming at young people aged between 11 to 19 who were in the early stages of assessment or therapy at CAMS. And the key elements involve a diary, my people, plans, questions, decisions, and help and support. And I'll talk through each of these ones individually. Before I do that, I'll just talk about some of the customization and personalization options. So to the left and to the right, young people can choose the color palette and the background options. And then in the middle, we have two different styles of icons that the young people can choose from. So they can either choose from a more cartoony style aimed at younger young people, or they can choose a more straight-lined effect for older young people. To the left, we can see the burger menu. So when young people first download the app, they're introduced to it, they have a welcome message and some guides on how they should go about using it. Young people were really keen that they wanted to be able to use the app in a flexible way, and it should guide them how to use it and not kind of be too instructive or prescriptive. So we've tried to incorporate that, and users can revisit the user manual and the guides at any point through the burger bar. To the right-hand side, we have the help and support. So these include a few pre-populated helplines, but also young people can enter any other help and support contact details that they would find useful. In the middle, we can see the main dashboard, and this revolves around my people. So my people are any others in a young person support network. So initially we had thought that it would just focus on CAMHS professionals, but actually young people were saying that was a bit restrictive and they wanted to be able to use the app with anyone who's in their support network. So young people can enter details of professionals, teachers, carers, friends, and then with the other sections of the app, they can flag all of those entries to a specific person in their support network. So it's really prompting them to talk about what they've entered in the app to a specific person in their support network. So some of the more kind of common elements I'll go through first. So we have a diary section, so young people can enter diary entries, so can talk about their thoughts, feelings and experiences, either in a session or between sessions. And they can enter information through text, audio, images, uploading a picture, or through uploading a short video. And these videos and images and audio files are all securely held within the app, so they're not also accessible through other parts of the smartphone, through the camera reel, for example. Young people were really clear that they wanted to have this flexibility and be able to enter information in a variety of different ways, which is why we've taken this, this kind of flexible approach. And young people also were really helpful in kind of guiding us on how we should balance kind of seriousness, but also being user-friendly. So they were really helpful in identifying which emojis would also be appropriate. Young people can enter questions that they want to ask those in the support network and answers to those questions. They can enter a plan, so a step-by-step guide of things that they can do in a period of distress. In the middle of the screen, we have the decision-making tool. So here a young person can enter a decision that they want to think about. They can then enter the pros and cons to that decision, and then the balancing scale will weigh up the pros and cons in line with the weights that the young person's entered for each pro or con. The exclamation point is used for a young person to flag something as particularly important to them, so it will be prioritised and come to the top of their list of entries. And then the image of two people talking is how young people can flag something to a person in their support network. So they can click on that icon and then it will take them to flag the entry to someone in their support network. So at the moment we're doing a feasibility trial, so we're working in 8 CAMs. We've recruited about 30 young people to the control condition, not receiving power up, but still completing the same measures. And we're recruiting young people in the intervention arm at the moment. Throughout consistent feedback, we heard that people thought the app could be used in a variety of different settings, so not just in CAM services. So we've actually broadened out and have done a feasibility trial in schools, which we're starting at the moment. So I'm sure you all have lots of experiences about some of the challenges and can think why we need to think about implementation and adoption. And I just wanted to highlight this great paper published a couple of weeks ago by Tricia Greenhalgh, which really synthesises some of the challenges and how we might overcome them. And I was particularly taken by the study they report of a Norwegian study where they were trying to implement telehealth, and they had all the kind of ingredients they needed. They had lots of people engaged, and still adoption of telehealth was only 1% in this particular study. And the reasons are rather complex. So this is their model of adoption, and they cover a range of micro or individual, meso, organizational, and then macro or policy and regulatory challenges. So yes, there are lots of things we need to be mindful of. And in particular, co-designing the app with young people, professionals and carers right from the start has really helped us to try and overcome some of these challenges. So we're able to design it to meet people's needs and also in a way that's going to fit with clinical practice. So I'll highlight some of the key themes that we've learnt. So young people wanted a private space. So initially we had thought about options for sharing data. So sharing information from the app with professionals. Young people weren't very keen on that because they really wanted a space that was going to be their own, because lots of information about them in terms of their healthcare records are held by others, which they struggle to access. The clinicians also weren't very happy with this option either because it raises a number of safeguarding concerns. So for instance, if a young person's saying something about they might want to hurt themselves, if they think someone's going to be immediately reading that, when in fact they might not be, then there's a safeguarding concern. So we took the decision not to share any data, so it's all held by the young person. We have a number of kind of security features, including a login, a PIN number, and the data is backed up to a secure server, and we've got quite a high level of encryption in the backup system. The people we consulted with thought it should be recommended by professionals, so we could really make sure that it was being recommended so it could be used appropriately and when it's clinically meaningful to do so. I talked through the concept where it's centered around my people. At the start, we had actually centered the app around my sessions, thinking that young people would be flagging parts to talk about in sessions, but the feedback we had was that was restrictive and not really how people wanted to use it. We received a number of feedback about the color, design, navigation, user-friendliness, and terminology. But moving on to some of the broader, more general things we've learned about adoption and implementation, I suppose I can't really stress enough the importance of strong relationships, particularly with collaborators. I think our steering group has been really fantastic and our tech partner has been really great and responsive. Having clear understandings with sites about what they're signing up to and what's going to be required of them is really important. And also having strong relationships with the research team and funders. For the kind of feasibility and pilot testing, this was so important, and I'm so pleased we've done this feasibility trial, because as we move into planning the full cluster control trial, I think a lot of these processes are going to be smoothed out. And I think working up process maps with sites about how it's going to work in terms of recruiting participants is really key to do at quite an early stage. Our work with young people really highlights the need to be able to flexibly engage them in the research study, so to try and engage them in a number of different ways. I think one of the particular challenges we had was really trying to start small in a controlled way, but also trying to start in a scalable way and be future-proofed. So probably the best example of this is just thinking about which platform we were going to develop on. At the start, we really wanted to develop it on one platform and get it right in the first instance, but we quite quickly heard from feedback that people just didn't like that, and they thought that was going to not be an accessible option. So we were able to change that and develop it across both Android and iOS. So I think that was a really good decision. Simple things like limiting the need for internet access was really important in developing digital interventions with young people, because they may have concerns about 3G usage allowances. So if they're going to be requiring to interact with the internet a lot without Wi-Fi, that could eat up a lot of their data. So we really had to limit the internet usage. I think planning how much you're going to be able to change in the intervention as you're developing it is really important. So you have the scope to respond to any surprises as necessary. And I think keeping the mission in mind, so you've got a clear objective and you're not creeping out to try and do lots of things in the app, is really important. I'll close just by reflecting on how important it is to build engagement and support. The Clinical Research Network has been fantastic in helping us to recruit sites and young people. And highlighting the amount of input young people and professionals have had in developing the app has also been really important to engagement. Through responses to feedback, we're developing a version for young people with additional needs, such as learning disabilities. So this is Power Up Plus, which is a new study we're just starting to work on. I'm aware I'm out of time, so I'll stop there. Thank you.